hello, everybody, and welcome back to another episode of Soul Focused Radio. This is your host, Martin Friedman.
And your host, Martina Tam.
Hey, Martina, how are you?
I'm doing really well. How about yourself?
I'm doing really well, too. Just finished up a week of being solo here while my wife and daughter were out doing stuff in the northern part of the United States of America. So I am getting ready for them to come home, which is a good thing. And being by myself was a good thing. So I'm holding both things simultaneously.
Wow, that's beautiful. Yeah, I had a good week. I was doing continuing medical education this week. But it meant I got to spend more time with my baby. And we had a great time, just mom and daughter time, hanging out, going to the park. She's like in that really giggly phase. So everything is super funny and it just brings me so much joy.
Nice. That's awesome. You know, I've often thought that if we could somehow like bottle the laughter of like, 1-2-year-old babies, that would be like the greatest antidepressant in the world. Like so much better than any drug we could ever give anybody. Because there's nothing that captures like the essence of joy, joyousness more than the laugh of a baby, your child's age and around. I like that 2-year-old, 3-year-old laugh that I remember from my grandsons back in Seattle. It's just so much unbridled joy.
Mm-hmm. It makes me think about something Madi said in one of our last episodes about how children see the world just full of possibility and full of joy. And it's just so true. Like they don't see the world with the pessimism and the negativity that we can often bring as adults.
Exactly. So even as we've been having this series talking about personal accountability and self-accountability, we're talking about joyousness. That is being accountable to ourselves because it's accountability to our true selves, not our ego selves. And so what we're saying is that recapturing that genius, the spirit, the joy of us as babies is part of being personally accountable and self-accountable.
Mm-hmm. Yeah, I'm super excited to continue our conversation today about personal accountability. We'll be talking about personal accountability in healthcare a little bit, and we have a very special guest who I'll be excited to introduce.
Awesome. Well, we can keep it a surprise, so people will have to keep listening. And as we get ready to transition to your segment, Martina, and I'm going to step back, I want to remind everybody to please, if you're listening, especially on YouTube, like, share, comment, and any platform that you're listening to us on, please share what we do. We're continuing to build and grow. We really want you to come and look at soulfocusgroup.com because we have a lot of great offerings. So as you get ready to listen, know that what you're hearing is the essence and the spirit of what we bring to everything that we do. So I would say, Martina, without further ado, let's listen to you and our surprise guest.
There is nothing more powerful than communication because we all have to do it and we're all doing it on some level all the time. When we are talking to ourselves or thinking, that's just another word for talking to ourselves, which means that we are doing what? Communicating with ourselves. When we are verbally speaking to other people, when our body language is demonstrating communication is so important because the world runs off of communication. So when you power up your communication, you essentially power up your life. At the Soul Focus Group, we invite everybody that comes to really delve into powering up their communication, transforming the way they listen, transforming the way they speak, transforming the way they connect to people, because that is where our power is. Power up your communication, people. We all need it.
Welcome, everybody, to another segment with Martina. We're going to be talking about personal accountability in healthcare, and I am super excited to bring a guest today. Megan Wilbert is our very special guest. She is a nurse practitioner at ICHS, which is the International Community Health Services, and she's also the director of their nurse practitioner residency, and perhaps most importantly, a mother of 2 beautiful young boys. And just super excited to have this conversation with her. Welcome, Megan.
Thank you, Martina. I'm so excited to be here with you.
Thanks for joining us. How are you today?
I'm doing really well. I'm also a fan of the Soul Focused podcast, so I'm excited to be here because I've been listening to your episodes and I've just found them to be really helpful. And so it's really wonderful being able to be a guest with you. So I'm excited about that. And then yesterday I had an unexpected day home with my kids, which started out, I started off feeling like it was kind of a crisis I had to manage because I didn't have childcare. And then I ended up being able to go with the flow and have a great time with them. Had some good reflections about what happens when I'm able to let go of control and let go of wanting things to be a certain way, being able to be in the moment more.
Yes, I feel like that has been one of the biggest learning pieces for me as a new mom. The moments when I
Definitely.
let go of the control, and like for me, cleaning is a big thing. When I let go of that, I can actually really enjoy time with my baby.
Yesterday, both my kids ended up in Lake Washington in all of their clothes. And that was the way and they had a great time, and I let go, and it was wonderful and beautiful. And there's so many moments like that in motherhood, just so many, teaching me a lot of patience and to continuously work on control.
Yes. And for the kids, I feel like as a kid, those memories for me are the most enjoyable. When I got super dirty, I got to just play. So you're building great memories, I bet.
And working on it, right? That's for me, motherhood. I appreciated what you said in my intro because motherhood is so much of what's on my mind right now. And I never knew how much it would bring to the surface, different ways that I continually want to be working on my healing and, my own moments of dysregulation, control, like I said. And I'm learning so much, so much. And it's just a really interesting time of life, especially to have two that are, under 7. I know I've heard you all talk about that 0 to 7 and how much kids are learning and internalizing at that time, right?
Mm-hmm. Yeah, the socialization that happens from 0 to 7. Well, we'll have to have you on Cindy's segment for parenting too.
I would love that. I can't wait to listen.
Yeah. But a little bit of a transition here. I was hoping for us today to talk a little bit about personal accountability in our work as healthcare providers, and both what does that look like for us? What personal accountability do we have? And then how do we also empower our patients and recognize their own personal accountability, which sometimes can even be, I think, the harder piece for me.
Mm-hmm. I would love to talk about this.
Yeah. So I guess tell me a little bit for you, kind of with your own, what's your journey been like for personal accountability for yourself? I know we're both you've been practicing longer than me, but we're both relatively new in our professions, and kind of that journey of learning on the job.
Yes. Well, so I'm a nurse practitioner and I'm actually a 3rd generation nurse. So my grandmother was a nurse on my mom's side. My mom was a nurse. And then I'm a nurse as well as a nurse practitioner. And I think a lot of what I was socialized around when I was growing up, and then I think was reinforced in the nursing profession through my training, was seeing myself as somebody that was there, that my role was to be helping people, to be assisting people, and in some ways to be kind of like a blank slate with patients, like almost approaching work like an unbiased researcher, or like, somebody who just is there, and is there as like a receptacle for whatever information or whatever we're discussing, and is there to kind of like take in whatever comes at me and then, be able to assist in whatever way possible. But I really don't feel like, both in my childhood experience and then again in my training, I don't feel like I really was trained in how to think about what I was truly bringing to each interaction with people, with human beings, and to think about the impact that I would have. And even like my reactions that I might be having in any given moment to what's unfolding in front of me, and then how I would impact, somebody's care based on my own internal reactions and what might be triggered in me. That's nothing that I learned. And it's something that as I'm going through my journey, just is becoming more and more clear, like that's my job, So that's what I've been sitting with and thinking about a lot right now. And really, I think in the beginning of my training, seeing the ways that and, it's still in some ways now, but for sure in the beginning of my training as a new provider, starting off in primary care, working in a community health clinic with people who are, on Medicaid, Medicare, people who are poor, who are getting state assistance or who aren't insured, and who have really complex and, deep struggles that are happening in their lives, physically, mentally, socially. I felt like I really struggled for sure in the beginning of my practice to know how to take all of that in and to be able to continue doing what I was doing with any ounce of joy. When I heard Martin mention that in the intro, joyousness, this conversation is about joyousness. I'm like, that is not what I was taught in medicine, in nursing.
Yeah. Yeah. Well, thank you so much, Meg. I mean, what you were saying at the beginning of being taught of just being this blank slate to take on anything that comes your way, like the emotion that gave me was just exhaustion.
Mm-hmm. Yes.
I'm wondering then kind of how has your journey been with sort of being started off, being trained, well, I have to just take everything that comes my way, to now what you were saying is being more thoughtful about what do I have to bring and what's the impact of that. What does that journey look like for you, and where are you at right now in terms of, what do you think you bring?
I think that this journey with work really parallels so much of what I'm also working on in my personal life, right? Which is around knowing myself better, developing a real awareness of myself, and thinking about how to have personal boundaries and how to have boundaries in my life with all of my relationships, including with my patients. And this for me is something that in some ways feels very unintuitive. Although I think probably, when we think about being soul-focused, I think this is soul-focused work. But the fact that having a sense of boundary internally would actually create more closeness or more intimacy with my relationships and deepen those relationships and allow me to be more present, that in some ways feels very opposite of what I felt like I maybe naturally learned or the way that I was socialized, both again as I was young and through my training.
Yeah, absolutely. I feel like especially in community health, so much of the ethos is I am giving my all to you. Like there is no personal boundaries. I will work 80 hours a week.
Yes, very much so. And in primary care in general, I think I hear that a lot. And just thinking about the culture that creates, right? The culture of like burnout and how that would even feel to a patient coming into an environment where not just the providers, but I think many, many of our staff are exhausted and unable to take care of ourselves, right? And what does that feel like to come into that environment? Is that really a healing environment?
Right, right. If your provider, if your healer is not well, how much healing can we do?
Mm-hmm.
So
yes.
I'm curious, something you said that I am curious if you have an example of, as you talked about how setting those personal boundaries has allowed you to be more present or even closer to your patients. I'm wondering if you have an example of that, because I think that's really beautiful, and I'm hoping to learn from you on that.
Yes, I have an example of a time when I realized that I really needed to look at this. I was 9 months pregnant with my second child, and so I had a 2-year-old at home, and I was trying to work as long as possible because I wanted to save up that time off to be able to take later. And I was definitely at a place of being stretched too thin. And looking back, I should have taken some time off. I wasn't in a place where I could really, be fully present for others because I wasn't taking care of myself the way that I needed. And I went into a patient room, and the patient was actually laying on the exam table in a sleeping bag, and she was homeless. And we started to talk, and she was very angry. And, of course, I'm sure nothing to do with me, right? Nothing that was personal. She had clearly had a lot going on in her life. And I just was unable to separate that myself and my own reactions in that circumstance. And I ended up, leaving the room and talking about it afterwards, reflecting on it and realizing I had not been able to really do anything for her because I'd been triggered, and realizing that my capacity for holding, or again, holding my own boundaries, keeping my cool, being able to be there for somebody else in the midst of their suffering was just not there in that moment. And I needed to take accountability and take responsibility for my own needs in order to really be able to be there for anybody else.
That is a powerful story and one we need to hear more, where personal accountability means self-care.
Yes. And really, again, I just can't emphasize enough. I think in medicine and in nursing, we're rarely having these conversations. And so it wasn't until later that night that I was able to really fully reflect on this experience and realize what I had brought to it. Like, I came out of the room thinking that woman was so mean, and just feeling like I wanted to cry. I wanted to, and feeling like, I'm pregnant. I felt like the victim. And then, looking back on it and thinking like, wow, there is such a strong power dynamic happening here, right? Like, I'm the provider. I'm coming into the room. She's clearly there in crisis. And yet I'm leaving feeling like the victim because I felt like she was mean. Like, wow, there's some things here that I need to really look at to be able to provide care for anybody else right now.
Wow. Thank you for sharing that. And I feel like that, we could have a whole conversation about maternity leave and lack thereof. And the role of that even, for our healthcare providers.
Yeah. But I think, so many of us, I think, in healthcare are, tell me what you think, what you're seeing, what you're observing. But I think so many of us are working like to the point of, either exhaustion or the point of not really being able to be fully present, not being able to put our triggers aside when they might come up, or to even maybe notice them in the moment, to be aware enough to notice them and figure out what we need in those moments, right? When we are working with people who are in crisis.
Yeah, no, absolutely. I was just thinking yesterday I had a really difficult day and how I was just so overwhelmed. Like, I couldn't bring my best self to each patient encounter, especially by the end of the day. Like, I was just burnt out. And it makes me think, Madhi talks a lot about our first mind and like our first reaction, and how oftentimes in those moments where we're in our own level, like our own situation of crisis or our own situation of stress, like we go back to our deep-seated socializations and bias.
Yes.
And that is, I think, where, we as healthcare workers have a lot of personal accountability. And I wanted to share a story with you kind of that highlighted this for me, where we were working in the hospital, we were working with residents, and we've started this practice where once a week we have residents present their usual presentation. This is a so-and-so-year-old person with this and this. But at the end of the presentation, they have to talk about how bias affected the patient's care, whether it's their own bias or just bias that they've seen. And we had a really profound situation. I wasn't taking care of the patient. It was a different attending physician. But he was a young 40-some African-American man with really advanced kidney disease of unknown etiology, almost needing to be on dialysis. And before you see a patient in the hospital, and even in clinic, we read about them in the chart and definitely develop our initial biases and thoughts about the person. So in this man's chart, all over the chart was saying that he left AMA, against medical advice. And so there was kind of a lot of blame in the chart saying, well, his kidney disease is advancing because he continues to leave against medical advice. And so when the resident was presenting him, it was her first day. He had just been admitted. She was saying, I read all this and thinking, gosh, this guy doesn't care about himself. He's just leaving AMA over and over. Like, how can we really help him unless he wants to help himself? She said, but then because we were asked to think about our bias, I asked him more, well, gosh, I see that you leave the hospital. Why is that? And he said, well, I'm a single dad. I have a 7-year-old. And when I'm not in the hospital, then my nephew, who's 19, takes care of my when I'm not at home, when I'm in the hospital, my 19-year-old nephew takes care of my 7-year-old kid. And that I can't be in the hospital for days on end. That's why I leave. And it completely transformed the way I think this resident and our team saw the patient and saw him as a human. and
Mm-hmm.
started to put aside and understand our own biases with this language that we have, even the language, AMA, it's all medical legal. So that way we don't
Mm-hmm.
get sued. And she started saying, okay, well, I understand now. This is why you leave. It's a great reason. Let's see if we can help you. So how much personal accountability do we hold when someone leaves against medical advice? Like, what are we doing to not aid them in their care?
Oh my gosh, Martina, this story brings up so much for me. It makes me think about so many things. And I'm so curious to hear what your reflection on it was as well. It makes me think about the podcast last week where you and Martin were speaking with Mahdi, with M. And he said this sentence, which has been sticking with me. He said, we don't see the world as it is. We see the world as we think it is.
Mm-hmm.
And then I think, we don't see people as they are. We see people as we think they are. And I think this is such a clear example of that, right? And when you think about bias, I mean, really, that's what it is, right? Having a certain perspective and thinking maybe that's the only perspective, that's the way it is, that's the truth of the situation, right? Versus really taking that time to think about what are the possibilities and to be open about it. And it even makes me think about that idea, what if clearly he was making the best decision for himself, right? And this example is really clear. But I'm also sitting with this question, like, what if he didn't have that child at home? And what if he was just making that decision, based off of what he wanted for himself, whether that it's, I think so many of our patients hate being in the hospital. And like, there's something about what we believe is a valid reason,
Yeah.
and it just makes me think, like that question you asked at the beginning of the podcast around allowing people to also be accountable for themselves. There's some piece here also about having it be okay. If people choose what's best for themselves and it's something different than what we think or what we might choose for ourselves, can that be okay?
No, absolutely. And so often, I mean, I think we think about, I feel like what I can offer as a provider so often is just medicines. And I don't blame people that that's not what they want to take. Like, I don't want to take medicines. But yeah, I think it also ties up to our own, or at least for me, my own like ego and sense of worth of like, well, if you take my recommendations, I can heal you, I can save you. It's that whole savior complex as well. And if you don't follow my recommendations, then gosh, what's my worth, And I think that mentality too, where our own self, at least for me, my own self-worth is tied up in patients choosing or not choosing to follow advice is another big part of it. And the kind of the ego in healthcare providers, like, I think we're trained, just like you're saying, if we're trained to just take on everything, like we're kind of being told, gosh, you can do anything. And it's not true. Like, it's exhausting, and we're humans as well. We have a limit.
Yes. And it's funny because we began this talking about a little bit about my kids and letting go of control. And there's a control piece here for me as well, right? The control piece around thinking that I always know what's best for someone.
Right.
And really needing to let go of that piece. And that piece, that control piece to me really is the antithesis of allowing people their own personal accountability, because in a way it's not seeing people as, it's not seeing people as their own infinitely powerful being, right? It's sort of like, I'm powerful, but you're not,
Right.
And I think for you also, when you asked about my journey and what I've been learning, what's been helpful there, it's really for me so much about this mindset shift, which there are things which I try to do. And when I do on a regular, daily, and really like moment to moment basis, they really help me to have better boundaries and to really shift my perspective, right? To see myself and my role at work as being in a real relationship with the patient that I'm working with, right? And so it's not like I'm in charge and they're in front of me, right? Or, I'm there as this blank slate, just taking in everything and then spouting out like what the research says, right? It's really like, okay, we have a relationship and we're partners and we're in this together. And maybe I have a role as a coach, or I have a role as someone walking along beside you and sharing what knowledge I have, and then learning what knowledge you have, and talking about it together and figuring out where we want to go. But that's what sits with me so much from this conversation, and in hearing about that story you shared, like really, looking at what does that relationship look like? What does it look like when it's working well?
So have you ever heard of a term called groundwater? Groundwater is another word we use at the Soul Focus Group that means subconscious programming. From the ages of 0 to 7, we are subconsciously programmed. So much information and choices and decisions are downloaded into our subconscious mind, and we begin to start living that life. And even though that life we're living is not the life we chose for ourselves, and it's not until we understand the impact of the groundwater, what the groundwater really is, that we begin to wake up to our own lives and begin to choose what we want for ourselves. At the Soul Focus Group, we bring you to that consciousness so that you can begin to choose the life you want to live for yourself.
So what do you do that you said you have some practices that shift your perspective? What are some of the things that you've seen develop for you as a practitioner to be in more relationship with your patients?
For sure. So much of it is about taking care of myself, and being aware in the moment of what's happening. And that's one thing that I've really realized for me is that, and I'm you've talked before here on this podcast about 12-step programs and recovery. And I'm a member of Adult Children of Alcoholics, or I love the way Martin calls it, adult children of dysfunctional families, or just adult children of families, right? Because so many of us really, I don't know how you can be a child of a family and not learn some dysfunction. But, through that program, there's a lot that I've learned, and I'm continuing to learn about myself in terms of codependency and the ways that I've been socialized to really use other people as a distraction from what's going on within myself. And so there's a lot of practices that I've developed around trying to have developing a greater awareness around what's happening inside of me and my body when I'm with people. And so some of that is just really paying attention when somebody's talking about a trauma they went through. How am I feeling? Noticing when I get tight or my stomach drops, or I feel some anxiety in my body, and being conscious to sit with that and notice that, where I think my socialization and what might feel more natural to me is often ignoring that and thinking in some way that the best I can do is pretend that it doesn't exist and focus on the other person, right? Which we know that anxiety or those feelings that I'm having will still impact the relationship, And so I think that focusing on me, what I'm experiencing, and processing that has been incredibly helpful.
That's beautiful. And gosh, what you're saying to me echoes so much of the Soul Focus Group approach of, we focus so much externally when we're, in the journeys that we talk about, like from Martin and Dee and Madi and their work in anti-racism, it was so much external focus. And really the answer is turning inward. And I'm hearing the same thing for you to be a healthcare provider, is that focus has to be turned inward, and that healing has to happen inward before we can even start to heal external from ourselves.
Yes. And there's something about that for me takes some of the pressure off, right? When I'm thinking, like, my job here is to be a witness to your journey and to be a partner with you. My job is not necessarily, it really isn't, not just not necessarily, but my job is not to heal you. Like that's your job. That's your body. My job is to walk alongside you. And, oftentimes that means that it's okay, or really the best and the most beautiful work that I could do would be like sitting with somebody and connecting with them and talking with them and developing a relationship. And that's like more than enough,
No, you remind me of this story. The other day, a patient came in just for like a general check-in, and we were talking about her job, and she got a new job. She got transferred to a bigger manager of a bigger store, but she was like, "Oh, I'm kind of disgruntled. They didn't give me this bonus because I transferred, even though I had to restock both stores." And just listening with her and processing with her, like she then was able to talk through how, gosh, I really should ask for this bonus. Like it's a lot of money. They obviously value me because they promoted me to a manager at a bigger store, and they don't want to lose me. And man, the CEO of this company is making a lot of money, and I'm doing the work. And just really listening to her, she was like, I'm going to go ask my boss for this bonus. And that honestly probably will make a bigger difference in her life than anything else. And like you said, I just sat there and just gave space for listening. And she talked herself through and, hearing her own self-worth. And that was probably the biggest impact I'll have. Like that probably is a bigger impact than some of the medicines that were being prescribed for her, of getting this bonus of like $4,000,
Yeah. I think about, there's a patient that I see who's in her 90s, and I work up in North Seattle, and she travels from the South Sound, right? Like over an hour to come up and see me. And
wow.
which is a lot for anyone, and especially when you're in your 90s. And she has a chronic fracture of her spine and has some chronic pain that she's dealing with. And there's literally almost nothing I'm doing for that, right? There's a few things. We talked about how to keep her bones strong and, how to prevent future issues as much as possible. But for a while, I was feeling like, oh, this is a patient that I'm not doing enough for. There's something more that I should be doing. And then I started really listening to her. And what she would say to me at every visit when she came was, I feel so much better after I see you, right? And it was like almost hard for me to take in at first. Like I didn't even really hear it, but then I really was listening and would say back to her, like, what do you mean? We just started whatever. And she's like, I just feel better. I come here and I get to talk with you, and then I leave and I feel lighter. I feel healthier. And I realized like that's such a beautiful thing. And that's really, and it's so important, I think, to take in those moments, like take in that compliment, and not having it in some ways really have anything to do with me in some ways. Although, again, like as an infinite, beautiful, powerful being myself, I also want to fully take that in, right? Like the impact of a human being connecting on a real human level with somebody else is not a small impact. But just really like taking that in, that's what kept her coming back to see me, all that long distance. And that's something that I can strive for with every person, right? Regardless of how much we always achieve that in every moment. Like that can be something that I do have control over, and that I want to keep working at, to have that be like what my primary goal is, in every interaction.
Yeah, that's beautiful. And just what I'm hearing too is we have to learn to trust the patient. Like you have to, like you were saying, you have to learn to trust her that it's worth it for her. She wouldn't be driving over an hour to come see you if it wasn't worth it for her. And to trust that she knows that it's worth an hour drive in her 90s through horrible traffic.
I just was thinking about what you said in terms of medicines, again, so much of our training is about medicine, about the, giving a prescription, recommending a treatment, doing an intervention, changing something physical, and just shifting that mindset to really focusing on those non-medical interventions as a big piece, and maybe the primary piece that we're aiming for.
Yes. It makes me think about the first episode that I was on where we talked about the placebo effect. I mean, the placebo effect is as effective, if not more effective, than some medicines. And it's just, I think, like we say, it's that feeling of being cared for. So what a gift that we are being given, where really our job, and I think I forget this, I think my job is to like meet these markers, like your A1C should be this. If you have this, you should be on a statin. You should get your breast cancer screening, colon cancer screening, blah, blah, blah. And like, I feel like so often those are the external markers given to us. But like that, your story, it just highlights really what we've been entrusted with is just giving space for relationships with people. And, in our topic for today, personal accountability, like what I'm thinking I'm going to take away from our conversation is, like you've said, seeing the infinite power of each person and just giving space for that to shine through in at least, giving space for that in our visit. Even if the rest of the day it's hard for someone's power, for them to feel their power, at least if we can give space for people to feel their power in our visit, that's probably the most impactful thing that can happen.
Yeah. And the power of presence, the power of bringing my own presence, you bringing your own presence, and the power of allowing someone to bring theirs and witnessing that together.
Well, Meg, I really want to thank you because I'm feeling a renewed sense of excitement to go to work on Monday.
I
And
love
I have to
that.
say, like after yesterday, we're recording on a Saturday. So after yesterday, Friday, I was like, I am not ready to go back to work for a couple of weeks after the day that it was. So I think, like you said, we're trying to find the joy. And so I really want to thank you because I think you're helping me remember and realize what a privilege and what a joy it should be in the work that we do.
Yeah, thinking again about that podcast last week, and Muddy talked about play, joyousness and play. And what does that really look like to play in medicine, especially and in nursing, right? Especially, in a field where we are often dealing with so much heaviness. What does that look like to keep our own joy and creativity and connection? And yeah, I mean, I love those opportunities when I feel like I can, playfully tease patients or connect on that human level. And I think looking forward to next week and thinking about how to really intentionally create more of those opportunities. I agree with you. That's an exciting place to be coming from.
Yes. I am hoping we can touch base next week and share some of the ways we were able to find joy.
I would love to.
It's something I know I am still learning, and I have a lot to learn from my colleagues and like yourself. So I'm looking forward to more connections with you.
That sounds great, Martina. And this was awesome. I hope we get a chance to talk again soon. Excited for more of these conversations.
Oh, definitely. I just want to thank you so much for taking time to talk with us and for your persistence in getting the computer to work. So thank you so much, Meg. Yeah, we had a little bit of struggle getting the recordings to work, but Meg we said, what, fifth time's a try?
Yes.
Or fifth time's a charm? I can't think of words the sayings, but fifth time's a charm.
Well, thank you. Thank you. And Martin, Muddy, again, I've just really appreciated these podcasts so much, and it's such a pleasure to be able to be a part of it.
Well, we'll definitely be having you back. So thank you again so much, Meg.
And take care. Have a great week.
You too. I'll talk with you later.
At the Soul Focus Group, we're probably one of the first organizations in the social justice movement to find ourselves moving away from fighting against racism to creating human solidarity. What we found is that we could fight 24 hours, 48 hours, or all our lives, and after fighting all this time, we have nothing to show for it, because we haven't created anything for ourselves. At the Soul Focus Group, we are one of the few organizations who have moved from fighting against racism to creating an alternative to racism. And we invite you to join us. Let's stop fighting and start creating the outcome we really want to experience.
Wow, Martina, that was awesome. I was playing the engineer role, so I got to listen. And I was actually doing some stuff around my house. So I was listening to it like it was a podcast, like a live podcast while it was happening. And I just want to just say it was really awesome. It was amazing for me to hear because it felt like I got to hear like two medical professionals talk in the way that you all probably talk to each other, but we don't often get to hear, so I'm just wondering how it felt to you. Cause to me, it was very cool. A lot of rich information, great stories. And also just like I said, I got to almost listen to a conversation you all might have in a lounge in a hospital or something, or, you know what I mean? Just between healthcare providers that I don't often get to listen to.
Yeah. Well, gosh, I wish there were more of these kinds of conversations happening in the doctor's lounge. But maybe someday. But no, it was a great conversation. Like I was saying at the end of it, I feel a renewed sense of excitement to find joy in my work. And so big takeaways for me. And I think this can apply in any profession, not just medicine. And Meg really highlighted is we have to take care of ourselves first before we can show up for other people in any way. And so that is really, I'm going to be sitting with that and reminding myself of that. The other big piece for me that Meg said, I shared the story of the patient who was leaving against medical advice to care for his kid. And Meg made the great point that, in our society, we see that as a worthy reason to leave against medical advice. But what if he just was leaving because he didn't like being in the hospital? And that is a worthy enough reason too that we should be understanding about. And so really trusting people, trusting our patients, and trusting that, and putting personal accountability on the patient too, and on everyone, again, doesn't apply just to medicine, that people know themselves. We may not always do what's best for ourselves, but that's where we are in our journey, and we need to trust people and honor that. And we shouldn't stigmatize someone just because we don't think their reason for doing something is a good enough reason in our book.
Yeah, thank you. I thought something very similar. I thought that was a really important point. Like what we value, there's just so much, in any profession for sure, but there's just something about healthcare too. There's something unique about every profession, but there's something very unique and very special about healthcare because literally it's like, us trying to stay alive, like going to you to help us stay alive or to help us have a more easeful life while we're here in these bodies, and that's something that, that is, again, it doesn't mean it's the most important profession in the world. I mean, when a bus driver drives a bus with like school kids in it, they're responsible for those school kids' lives. You know what I mean? So it's not like it's the only time that people are responsible for other people's lives. And it's just something that there's just so much, we talk all the time at Soul Focus Group, Martina, about groundwater. And there's so much in our groundwater about doctors, nurse practitioners, nurses, healthcare providers that I think you all kind of rolled the curtain back on that a little bit. And that was very powerful to me as somebody who's not in that field and is a consumer.
Well, I'm glad it was powerful for you. I hope it was relatable, and we welcome questions and comments that we can talk about at our next podcast and respond to. And I'm also really hoping that that Meg will come back more. It was such a powerful conversation with her, so I'm really excited to have her on the podcast more often as a regular guest.
Absolutely, and honestly, and I'm not just saying this because you're both friends of mine and colleagues and everything, and I've known Meg for a long time. One thing that did stand out to me too, and maybe another time that you come on, or that she comes on with you, you talked about how Dustin, my D, and myself were in this, the social justice world for so long, and some of our experiences. Megan was too. I've known Megan since she was 16 years old and was a member of Youth Undoing Institutional Racism. And so, she's seen that world too, the good, the bad, and the ugly of it. And I think having that conversation with her sometime in the future about how that relates, because there is a lot of relatability to me in those worlds. So, I've known Megan for a really long time. I haven't known you as long, but, I feel that we've gotten close in the small amount of time we've known each other, relatively small amount of time. And, for me, it was just awesome to be able to listen to you all. And I know that, these are relationships that are going to be moving forward. And I know I just distracted myself of what I was trying to say to you. And I was trying to say was, I actually think this could be used in teaching. What you all just talked about, I could see being used in teaching, nurse practitioner students, medical students, healthcare providers, because I think that's something that isn't taught, as you all said. So even though I am biased, that's what I was trying to say. And that was that even though I'm biased, I think it would be awesome for that to be taught to up and coming healthcare providers.
I would love that. And I love that Meg is the director of her nurse practitioner residency too, so she can bring this knowledge and change the culture of how we're raising up more healthcare providers. So thank you for that, Martin.
Absolutely. Thank you, Martina. Thank you, Meg. Thank all of our listeners, as always, for being here for us, with us. We ask that you come on this journey with us in whatever way that makes sense to you. If you're a new listener today because you just came on to listen, about the healthcare profession, check out some of the other stuff that we do too. Check out some of our other podcasts. Go to soulfocusgroup.com. We have a lot of offerings. We've done a lot of work in the healthcare field. We have, people like Martina, like Megan, who we can call on to translate everything that we do into the healthcare world. So we're just excited for everybody to be on this journey with us. We love you. We care about you. And Martina, we want people to stay safe and stay well. And what else do we want them to stay?
Soul focused.